Welcome back. In the second quarter hour of today's show, my guest is Dr. Stephen Stewart, Director of Prescott Cardiology and the new Arizona Cardiac Sleep Facility. Welcome.
Thank you. Thanks for having me.
My pleasure. And I have to ask you the obvious question. The new Cardiac Sleep Facility, what's that all about?
Well, we've been finding over the last few years that there's a big connection between heart problems and sleep disordered breathing, or more commonly known as sleep apnea. Mm-hmm. There's quite a link there that hasn't been recognized until recently. So we decided to open the Arizona Cardiac Sleep Facility so we can do sleep testing and treat sleep apnea patients, as well as look after their cardiac problems.
And that new facility is on Ainsworth?
Right, 804 Ainsworth, Suite 102, right north of the hospital.
And you are the founder of that, but also a cardiologist, and have been here in town for a while.
Yeah, I've been here for about 10 years.
Talk a little bit about your background and the training you went through to.
Okay, sure. Well, I finished my cardiology training about 26 years ago, and I've been working as a general cardiologist since then. Got interested in nuclear cardiology, doing stress tests and that sort of thing, became board certified in that. And then about 4 years ago, I got interested in sleep medicine because I was seeing a lot of connections between heart problems and sleep problems. So I actually studied that, and we started doing sleep tests in our facility. And then I took a board exam and actually passed that and became board certified in sleep medicine.
Okay. And that's part of heart disease. We're in an older community, as we know, a lot of people aging and many with heart problems.
Sure.
Why should people be interested or concerned about their heart? There's the obvious answer to that, I know.
Yeah, I mean, the biggest reason is it's probably the leading cause of death in our country. In women, it's the leading cause of death. You often think of breast cancer as the leading cause of death in women, but it is heart disease, and in men as well. Every year there's 750,000 heart attacks. So it's very common, and especially as you get older, there's more risk for developing heart problems.
I think the good news is, and I'll have you expand on it, but the good news is it's a treatable disease.
It is. It's treatable. It's also preventable. Some of the risk factors, you probably heard a lot of this, but age, being male, family history of heart disease, if you're postmenopausal for women, African Americans, American Indians have a higher prevalence of heart disease. And then there's some of the things that we can do to prevent or at least reduce the risk for heart disease, like quitting smoking, getting your cholesterol under control, watching your blood pressure, controlling your diabetes, watching your weight, watching your stress and anger levels. And physical inactivity is being recognized as a major risk. There's a quote going around now that sitting is the new smoking in terms of risk factors for heart disease.
Can't do anything anymore without it causing something, it seems. Let's just take a typical patient and put him or her through the new sleep facility that you've got. What actually happens? Do they check in for the night?
Yeah. Well, first of all, how would the patient come to our facility in the first place? They might refer themselves if they think they have a problem with sleep apnea, or they might be referred by their family physician. There's a scale that we use that measures how sleepy a person is during the day. It's called the Epworth scale, and it takes 5 or 10 minutes to fill out. So we give that to every new patient that comes in, whether they have heart disease or they're just coming in as for a screening. And that will tell us if they have a high score, if they're getting sleepy during the day a lot. And that can be one of the main symptoms for sleep apnea. There's other indications. Somebody with atrial fibrillation, irregular heart rhythms is a high risk for sleep apnea. Somebody with heart failure, lack of energy, morning headaches, depression, they can all be symptoms of sleep apnea. So once the person is there and we determine that they're a candidate for a sleep study, they'll actually come in and spend the night. And we have 2 rooms. They're very nice. Reminds me of a bed and breakfast facility. And we actually study them while they're sleeping. We have them hooked up to monitors that measure oxygen, breathing patterns, heartbeat, brain waves, a lot of things. And over the night, we can determine if the patient either stops breathing for 10 seconds or more, or if their breathing slows down to where their oxygen levels drop. And so this is all recorded, and then I'll come in and analyze that, and then we see the patient for a follow-up and go over the results and determine if they have sleep apnea, how severe it is, and what would be the best treatment for them.
Is sleep apnea being caught more by the doctors these days? I mean, it's probably always been there as a issue,
right.
as a disease.
Yeah, I think it's being more recognized. There's probably about 1/4 of adults have some form of sleep disordered breathing, and I think the family physicians are becoming more aware of some of the symptoms, and patients are becoming more educated themselves.
One of the questions we wanted to ask you was the link between heart disease and sleep.
Right. Well, there probably is a lot of link between the two. We know that people with heart failure have a very high incidence of sleep apnea. Also, people with hypertension that is difficult to control tend to have a higher incidence of sleep apnea. People that have had a stroke also have a high incidence of sleep apnea. And what we found is that controlling the sleep apnea with either a mechanical device called a CPAP or sometimes an oral appliance that's fitted by a dentist that helps to open up the airway, allows the person to breathe more efficiently. By treating the sleep apnea, it actually helps these other conditions.
You said a couple of minutes ago that a number of the people who come to the facility self-refer.
Right.
And that surprised me a little bit because I thought this was the kind of thing that maybe a family doctor would say, you really need to try this sleep disorder test.
Right.
The people that self-refer, what clues them in that they may have a problem?
Well, a lot of times the patient is referred by their spouse or significant other, somebody that snores a lot, or somebody that they have witnessed apnea where the person notices their partner has stopped breathing, which is abnormal. Or maybe they just feel very tired, very sleepy during the day, and wonder if they might have sleep apnea.
Is anyone actually cured of sleep apnea, or managed?
There are probably some people that are cured, some people are managed. The CPAP does pretty well as far as managing it. If you stop using the CPAP machine, then the sleep apnea comes back. People using the oral appliance, that's a very simple device that can manage sleep apnea, but again, if they stop using it, it will probably come back. There are some surgeries that will actually cure it, although in adults has not been as successful as in kids.
And on a level of say 1 to 10, how serious a disease is it?
Well, it depends on how...
If you could put a number to it.
Yeah, it depends on how severe the case is, but in general, I would say it's a significant disease, and it's not been recognized. About 75% of cases aren't diagnosed. And If you think about it, it really does put a stress on your system, because when your oxygen level drops, when you're asleep, that puts a strain on your heart, your nervous system, pancreas, all kinds of things, and can really lead to a lot of problems.
And the sleep apnea test shows.
The sleep apnea test would show whether a person either has it or how severe it is.
Okay. So if people listening and thinking, gee, that kind of sounds like my issue.
Yeah.
How do they get a hold of you?
Well, you can call our office. We're right here in Prescott, 776-0601. You can go to our website. We actually have two, prescottcardio.com, or our sleep website is azcardiacsleep.com, or you can just Google it and should be able to find it pretty easily.
Okay. Anything that I left off?
Well, we
covered a lot.
We could talk for hours, but I think we hit the main points.
Okay. Dr. Stephen Stewart has been my guest for this segment of the show from Prescott Cardiology and the Arizona Cardiac Sleep Facility, brand new here in town. And hopefully people, if they need help, will call.
Thank you.
We're going to take a break and catch up on some news headlines, and then be back with more guests on today's Talk of the Town, 11:30 a.m., 99.9 FM, and on the web at KQNA.com. We'll be back.